Members of the House of Representatives have spent hours today debating President Donald Trump's tax cut and spending plan, the domestic policy bill. Different versions of this bill have passed through the House and the Senate, each by the slimmest of margins. Right now, it is now back in the hands of the U.S. House, where Speaker Mike Johnson can only afford to lose 3 votes. Republicans who support the bill insist it fulfill President Donald Trump's campaign promises. Democrats are slamming the bill's steep to Medicaid that, by one estimate, stripped health insurance coverage from nearly 12 million Americans over the next decade. But if you were on Medicaid or even looking to enroll, how would you be affected? Today, we work to get some answers for you as the state's health care systems are closely watching President Donald Trump's bill. WHS 11's Isaiah Kim Martinez is talking to experts today, and a Louisvillian who was on Medicaid for years. And Isaiah, what did you learn from her about that?
Well, Doug, I want to mention I talked to a man who helped make changes to Kentucky's Medicaid expansion program that was under former Governor Matt Bevin. He told me if small rural hospitals close, our big healthcare systems will be overrun with transfers they're already struggling to accept every day.
It's not a perfect system, but it's needed healthcare coverage. Angela
Hopperton of Louisville is invested in the conversation around Medicaid's future.
I don't make a whole lot of money, but I'm lucky enough to make a living doing what I love. So that's important to me.
The program provided her health insurance for 2 years.
I would say, oh, it makes me feel great. I'm not on Medicaid anymore. Why should I care? Except millions of people in this state still are.
Starting in early 2026, Kentucky would see a 10% decrease in funding for a Medicaid model the state uses to pay health care providers. That's if the latest version of President Trump's big beautiful bill, including billions of dollars in cuts to Medicaid, passes the finish line. Mark Birdwhistle is the Senior Vice President for Health and Public Policy at UK.
I think this change, if it lives from the Senate, and if the House were to adopt it, it will cause us to reassess everything that we have in our planning horizon.
Shelbyville Hospital, seen here from our Sky 11 drone, generates more than $36 million in operating revenue and has no plans to close, according to a Bell Health spokesperson. But we're told if this mega bill passes as is, hospitals across the state will be forced to consider significant changes in how healthcare services are delivered.
I do fear for lack of access close to home for a lot of people, particularly in rural Kentucky.
Kentucky Senate President Robert Stivers has a different view.
It is not a cut, just not as great of an expansion. Did you hear a single university hospital or the KHA complain about the bill? No.